of cases in the second wave. Challenges include shortages of nurses with experience in intensive care units. The Eastern Cape provincial government briefed the media this afternoon. Premier Oscar Mabuyane has welcomed the vaccine rollout plan announced by the Department of Health.
The most critical resource to help COVID-19 patients when they are admitted in our health care facilities is our health care workers. They bear the most brand of COVID-19 in the front lines every day. They work long hours and they have seen the worst that this virus can do. To alleviate this pressure on them, we have appointed 310 clinical staff who have completed their community service. In addition, a further 625 professional nurses will complete their community service training in April and will be utilized on the front lines. We have a challenge in the market of getting nurses, especially those who can mend the critical care beds as well as the ICU beds. So we are working very hard to really make sure that these issues are addressed. I've told the MEC and the HOD that we must actually replace the permanent posts of nurses that are either retiring or are getting out of system for various reasons. We can't have that one delayed because we need nurses, and part of the reason that we're struggling to get nurses, no one is prepared to leave a permanent job for a contract job. We welcome the announcement by the Minister of Health to bring forward vaccine procurement availability and the start of vaccination for healthcare workers as a priority, the elderly and vulnerable groups, as early as February. There are people who are recklessly spreading falsehoods about vaccine without any share of knowledge about vaccine, telling our people that they should not take a vaccine when it arrives. I think it is about time that our law enforcement looks into such people seriously because they pose a threat to the health of our people. Our people should trust government as the only credible authority on vaccine and the process that will be followed to roll it out. We will ensure that our staff are trained to achieve a rapid rollout of the vaccine. We will also work with all critical stakeholders to ensure the effective rollout of the vaccination program to stop the risk of a third wave and ease economic disruptions and social impact caused by the stringent regulations. We will henceforth set up a provincial coordinating committee as required by national for the vaccine rollout to advise us on technical, social, and ethical issues related to mass vaccination of our communities. We want to assure the people of our province that our mandated interventions on vaccine and vaccination will be guided by science. We will follow ethical principles and we will ensure rapid implementation to achieve the required level of the herd immunity to prevent COVID-19 transmission and to achieve containment levels towards total elimination of the virus by the end of 2021.
All right, for more on this, we are now joined via Zoom by Dr Adrian Puren, who is the head of the Center for HIV and AIDS at the National Institute for Communicable Diseases. It's always a pleasure to see you. Doc, welcome back to our show, sir.
Good afternoon. Good afternoon to you and to your viewers. Thank you for the opportunity.
You're most welcome. Of course, now we're all concerned about the second wave of coronavirus. And as I look at these numbers, in the latest 24 hours, 434 people have died. One would have thought that we've learned some significant lessons from the first wave. From where you're sitting, Doc, have we not learned any lessons? Will this be more deadly? Will the second wave be more deadly than the first from where you're sitting?
It is likely, yes. In fact, because this resurgence, really, or second wave, as you've called it, and many of us do use that term as well, certainly shows us in terms of the numbers of infections have certainly increased much more than we've seen in the initial surge. And so you can see that in the different provinces, including the Eastern Cape, Western Cape, KwaZulu-Natal, and now Gauteng, and we are certainly starting to see this resurgence in other provinces as well. And associated with this large number of people that have been infected and are infected is that there's also a larger number of people that are being hospitalized and require to go into ICU, require oxygenation, for example. And one of the sequelae of not always being able to manage these cases is, in fact, an increase in mortality. And we're definitely seeing that in many of the provinces. So in many of the provinces, at least in the ones that we've seen this resurgence, like the Eastern Cape and the Western Cape, certainly mortality is certainly much higher than in the first surge.
You know, the other topic that's obviously on everyone's minds at the moment that we're all kind of talking about is the issue of the vaccines. No doubt you saw that briefing by the Minister of Health. There's been some heavy criticism leveled at the government in terms of when South Africa will and can be able to access vaccines. Where do you stand on this issue, Doc? A lot of people saying, look, a month is far too long, considering the fact that we are currently in resurgence, as you put it in the medically correct term. We are there right now, and a month is just far too long to wait. And I might have to agree with that, because if we're having 434 deaths in a space of 24 hours, I can't imagine what would then be happening in a month. I mean, you look at the fact that other countries have begun to do mass vaccinations, have started to vaccinate their vaccines. Our numbers are scary. Where do you stand on this issue of having to really wait a bit longer for the vaccine to arrive?
Yes, I'm afraid we are going to have to wait, and I think that there's much discussion around where we are with the vaccines, and those discussions continue. I see that the Minister of Health, I think, has said that at least in February that the vaccine will become available, and I would think that focus would then really be on our healthcare workers. I've seen your clips earlier on showing again the fragility of our health system. The need for nurses is really critical, and other healthcare workers is really critical. So I think the vaccine, the sooner it is here, the much better to start off with that. As you know, it's going to be a phased-in approach, and then focusing on other vulnerable groups, such as those in care facilities and so forth, in order to protect those particular individuals. So it's going to be a phased process, but I think it's going to be a long process. So I think, unfortunately, we're going to have this particular surge, and we may well have further resurgences occurring until we reach that magical number of 67%, if not higher, in terms of herd immunity. Yeah. I must say, though, that if you look at the UK and the United States, they've certainly, and we will certainly learn from that, is that the introduction of the vaccine has not always been as smooth as we thought it and had hoped it would be. We've seen the numbers again, at least in the UK and in the United States, has not reached the critical numbers that is thought to really be effective. So again, it's something that we need to bear in mind, that when it is introduced, that we actually have a good, solid plan that will ensure efficient introduction of the vaccine.
Dr. Puren, you talk about the 67% for herd immunity. I was actually having a conversation just yesterday with one of your colleagues, Dr. Dadu, and I told him about the fact that there is concern around some people not trusting the vaccine, having issues against the vaccine. And I'm sure you've seen some of the commentary. In fact, some people in leadership positions are making some allegations around what this vaccine is about. I'd like to paint a picture, and perhaps you can just help to analyze this. What would happen, and as Dr. Dadu said, people do have the right to say, no, I don't want to take this vaccine. What would happen if we were faced with a situation where, let's just say, 50% of the country says, I don't want this vaccine. I'm invoking my right to say that I will not have this vaccine. Now we've reached a situation where we can't have the 67% for this herd immunity. What would then happen in a case like that?
Yes, so it's going to be unfortunate and it's going to be tragic in the sense that if we do not reach those targets of really broad community immunity against this particular virus, that would mean that the virus will have continued transmission in communities where they are vulnerable, in other words, where the vaccine has not reached. And the consequence of that may well be that, again, if, for example, there are vulnerable communities in terms of comorbidities, age, then we're going to see the consequence of that is continued hospitalizations, so continued stress on the hospital service, both in terms of the infrastructure, such as supplying of oxygen, as well as on its staff. And of course, one of the consequences, as you've seen already, is death. And so we're going to continuously see those particular events. And I think it's really important that we engage and communicate with our communities at all times about what a vaccine will mean and how effective it can be and how protective it will be. I know that for the majority of people who get infected, they will recover. And we've seen the figures, you've read figures about 83% currently, up to 90%. However, there are still within those groups of people above the age of 20 that will end up in hospital and will die. So I think it's really important that we communicate that the vaccines, and this is where transparency and the science is so important, that we show the steps of how we've come to the fact that we think that this vaccine is effective, it will be protective. Yeah. And that if we can convince people that it is effective, that in fact we can overcome some of the risk-averse approaches that people may well adopt. South Africa has a good program, it has since 1996. Yeah. In terms of childhood vaccinations, for example, that's been an effective program in the main. And you can see the consequences very often if you don't sustain the vaccine program. So measles is a very good example. We have very few cases of measles as we slowly but surely reached our target. Polio, for example, in South Africa has been essentially eradicated. Yeah. So I think we need to convince people that, yes, we got this vaccine in a very short space of time. We can show the science that it is effective, that it is safe, and hopefully convince people that taking up the vaccine will be critical, because if we don't reach that level of community immunity or herd immunity, then ongoing transmission or pockets of ongoing transmission will simply just continue, and therefore we will still have to have the need for the wearing of masks, the physical distancing, all those particular MPIs will still then need to be in place. I'm not saying that they're going to disappear in February when the vaccine arrives. On the contrary, we still need to have that all in place, but it's the build up towards the community immunity that's going to be critical.
Dr. Puren, as the head of the Center for HIV and AIDS, I will assume that your knowledge on HIV and AIDS is far superior to most of us. So I'd like to bring you into this, and I don't know if anyone has asked you this, but this is a question that I've seen on social media, and I've often wondered how this would be answered. So let me put you there on the spot then. There was a question about, well, we've had HIV and AIDS for many, many years. There's never been a vaccine, to prevent the transmission of HIV. But suddenly, in a space of a couple of months, we've got this vaccine to deal with coronavirus. And of course, this is some of the arguments by those who are skeptical about this vaccine that will be rolled out. Why is this the case then? I mean, is that even a good debate? Is that something even good to put forward as an argument in terms of saying there's no vaccine against HIV, but there is now suddenly a vaccine against this virus that we just got introduced to? What do you make of that?
Well, there's a famous phrase called "chance prepares the mind," yeah. And in fact, if you look at the production of this particular vaccine, for some of the investigators from Oxford have actually been working in this particular area around coronaviruses, because you remember there was SARS-CoV. And then there was MERS. So I think there's been lots of investigations around trying to prepare and work towards a vaccine. I think that also, when you look at the viruses, they are rather different. And one of the biggest challenges with HIV has been, for example, the marked mutation rates that have certainly influenced vaccine development. We've certainly tried to look at various candidates. There have been various trials, huge-scale trials, still ongoing, to really try and obtain an effective and safe vaccine, but there've actually been multiple challenges. And so I think the challenges may well have been different. I think the science has also changed very dramatically over the last year in terms of the availability, from getting a sequence by January right up to the point where one could actually have a vaccine go through licensure. So I think there are differences. There are different viruses. The levels of mutations, for example, in the SARS-CoV-2 are really different, and therefore your targets are different, maybe much more easier in some ways to obtain a vaccine, but still challenges remain. And in fact, this is just the beginning of some of the vaccines that we will see for SARS-CoV-2. There may well be others and improved vaccines as well, because remember, some of these vaccines prevent infection, but not necessarily transmission. And so there will certainly be improvements.
All right. Dr. Adrian Puren, it's always a pleasure to have you with us on your show. Your input is very much appreciated. Thank you, sir.
Thanks, Flo. Thanks for the opportunity.
All right. That's Dr. Adrian Puren, the head of the Center for HIV and AIDS at National Institute for Communicable Diseases.